Hello, and welcome to Registry Partners August 2025 Oncology Coding Break, Palliative Care Treatment Coding. During this presentation, I will define palliative care, talk about STOR description, rationale, and codes, and go over a few case examples. By definition, palliative care is medical care focused on improving the quality of life by managing symptoms and stress both physically and emotionally. According to Wikipedia, palliative care is appropriate for individuals with serious chronic illnesses across the age spectrum and can be provided as the main goal of care or in tandem with curative treatment. It is ideally provided by interdisciplinary teams, which can include physicians, nurses, occupational and physical therapists, psychologists, social workers, chaplains, and dietitians. Palliative care key aspects include symptom management, emotional and spiritual support, quality of life focus, and integration with other treatments. Symptom management would include management for pain, fatigue, nausea, and other types of symptoms. Emotional and spiritual support addresses psychological and spiritual needs and helps patients and families cope with the challenges a serious illness can bring. Quality of life, improve overall quality of life for both the patient and family. Palliative care in cancer patients are integrated with other treatments. Palliative care can be provided alongside curative or life-prolonging treatments and is performed to relieve symptoms and may include surgery, radiation therapy, systemic therapy like chemotherapy, hormone therapy, or other systemic drugs, and/or pain management therapy. Let's now dive a little bit into STOR and the definition and coding of palliative care. STOR 2025 Palliative Care Rationale allows reporting facilities to track care that is considered palliative rather than diagnostic or curative in intent. The description identifies any care provided in an effort to palliate or alleviate symptoms. Palliative care is performed to relieve symptoms and may include surgery, radiation therapy, systemic therapy, and/or other pain management therapy. STOR instructs us to record palliative care, any treatment recorded in the first course therapy items that was provided to prolong the patient's life by managing the patient's symptoms, alleviating the pain, or making the patient more comfortable. As a side note, do not code routine pain management following surgery or other treatment, but you do want to code first course pain management for persistent pain. You also want to look in the medical record for a physician's statement of treatment being palliative. Listed here are the 9 codes in STOR available for coding palliative care. Also note there was a 2025 update to STOR. If hospice was recommended and received, capture the type of care provided to palliate or relieve the patient's symptoms. If hospice was recommended and received, but it is unknown what type of care patient received, assign code 7. Also note, hospice is a service. The palliative care the patient receives while on hospice is what is coded. So let's look at a few case examples. Here we have a 65-year-old white male presented to the facility ED with excruciating pelvic pain. Prior to presenting to the ED, the patient was diagnosed with prostatic adenocarcinoma, Gleason's 4+4 = 8. No staging workup had been completed at the time of the ER visit. Due to the patient's excruciating pelvic pain, imaging was ordered and revealed metastatic bone disease in the right hip. The patient was seen in consultation by radiation oncologist, and the radiation oncologist recommended palliative radiation targeting the metastatic bone disease to alleviate his symptoms. The plan was for the patient to receive 3,000 CGY to the right hip using 3D technique over 10 days. So first we want to code in that radiation fields the radiation that was received. The volume will be coded to 84 hip. Radiation to nodes will be coded 00 because no nodes were targeted at that time. The modality will be coded O2, external beam photons. The technique will be code O3 for 3D. The number of fractions given were 10 and will be entered as 010. The dose per fraction was 3,000 CGY and will be entered as 00300. And the total dose given was 3,000 CGY and will be entered as 003000. The palliative care field will be code 2, radiation therapy to alleviate symptoms, but no attempt to diagnose, stage, or treat the primary tumor being made. Both the radiation fields and the palliative care fields are coded in the abstract. Text should also capture the intent of the radiation, i.e. palliative 3D photons to the right hip, 3,000 CGY given in 10 fractions, and the dates of treatment. Let's look at another case. So here we have a patient that was diagnosed with stage 4 small cell lung cancer with agonizing and acute rib cage pain, refractory to over-the-counter pain management. The patient was seen in medical oncology consultation, and due to the extent of disease, palliative systemic therapy was recommended. The patient received palliative cisplatin and docetaxel. The patient was also prescribed hydrocodone to relieve the pain. So we will code the systemic chemotherapy as code O3 for multiple agents as the patient received cisplatin and docetaxel. Now let's look at the palliative care options. Code 3 is chemo, hormone, or other systemic drugs to alleviate symptoms, but no attempt to diagnose, stage, or treat the primary tumor is made. Code 4 is patient received or was referred for pain management therapy with no other palliative care. And code 6 is any combination of codes 1, 2, and or 3 with 4. So in this case, the patient received both chemotherapy and palliative hydrocodone. So the code in palliative care would be coded as 6. Thank you for listening to this month's Oncology Coding Break. Please reach out if you have any questions, and have a great day.